At some point in our lives, we are all affected by illness or injury. 85% of seniors live with at least one or more long-term chronic illnesses, such as arthritis, high blood pressure, heart disease, or diabetes. Many people who develop chronic illnesses or who suffer debilitating injuries are cared for at home by skilled caregivers, including CCAs. Because their bodies are unable to work as they should, these clients need assistance in meeting their basic needs. Many of the illnesses or injuries you will see as a CCA begin by affecting an organ in the body. An organ performs a specific function. For example, the heart pumps blood throughout the body. A group of organs works together as a system that performs a job for the body. All of the body's systems work together to make the body function. Because all of the body's systems depend on each other for proper functioning, injury or disease in one part of the system affects other parts of that system, and eventually other systems. Over time, a malfunctioning organ causes stress on other organs and systems, and a negative chain reaction occurs. This chain reaction can lead to failure of all the body's systems and even death. Homeostasis is the name for the condition in which all of the body's systems are working at their best. In order for the body to be in homeostasis, its metabolism, or physical and chemical processes, must be operating at a steady level. When disease or injury occurs, the body's metabolism is disturbed, and homeostasis is lost. Changes in metabolic processes are called signs and symptoms. For instance, changes in body temperature could indicate that the body is fighting an infection. Changes in pulse indicate that the body is trying to increase blood circulation to meet a new demand. Noticing and reporting changes in your clients is a very important part of your job, because the changes you notice could be signs of significant problems. Each system in the body has its own unique structure and function. The body's systems can be broken down in different ways. In this course, we divide the human body into 11 body systems. The first is the integumentary system, or skin. Second, the musculoskeletal system. Third, the nervous system. Fourth, the circulatory or cardiovascular system. Fifth, the respiratory system. Sixth, the urinary system. The digestive or gastrointestinal system. The eighth is the endocrine system. The ninth is the reproductive system. We then have the immune system, and finally the lymphatic system. The body systems can be damaged by trauma, infection, genetics, in other words, birth defects or conditions that develop or worsen with time, or by exposure to chemicals and toxins. Such damage can lead to disease. Disease can cause disruption of the normal functions of the body. It can cause discomfort, disability, and even death. Chronic illnesses that gradually get worse with time are known as progressive or degenerative conditions. We won't take a lot of time detailing the body's systems here, but we will give basic definitions for each of them. For an in-depth presentation of body systems, please refer to the CCA manual available from your supervisor. I think you'll find the information very useful. The integumentary system. The largest organ and system in the body is the skin, a natural protective covering or integument. Skin prevents injury to internal organs and protects the body against entry of bacterial organisms. It prevents the loss of excessive amounts of water, which is essential to life. Skin is made up of tissues and glands, structures that secrete fluids. The skin is also a sense organ that feels heat, cold, pain, touch, and pressure, and then tells the brain what it is feeling. Body temperature is also regulated in the skin, which has blood vessels that dilate or widen when the outside temperature is too high, bringing more blood to the body surface to cool it off during evaporation. The same blood vessels constrict or narrow when the outside temperature is too cold. By restricting the amount of blood reaching the skin, the blood vessels help the body to retain heat. A common illness of the integumentary system is pressure sores or decubitus ulcers. Pressure sores occur when the skin deteriorates from pressure and shearing, that is, pressure from sliding skin across another surface. Eventually, blood does not circulate properly and sores or ulcers form. They swell and they may become infected. This condition occurs most often to clients who are confined to bed for a long period of time. Generally speaking, the clients you care for are more mobile than that, but because pressure sores are such a serious condition, you should read the additional information on pressure sores in the CCA manual. During daily care, the client's skin should be observed for changes that may indicate disease. Any of the following conditions can be signs of illness and should be reported to your supervisor immediately: redness, rashes or scales, bruising, cuts, boils, sores, wounds, abrasions, changes in color or moistness and dryness, swelling, scalp or hair changes, or skin that appears different from normal or that has changed. The musculoskeletal system. Muscles, bones, ligaments, tendons, and cartilage give the body shape and structure. They work together as a system of pulleys and levers to allow the body to move. The skeleton or framework of the human body has 206 bones. Muscles provide movement of body parts to maintain body posture and to produce body heat. The musculoskeletal system is directed by the nervous system to move the body to action. To stay healthy physically and mentally, the body must be mobile and active. Physical activity reduces tension and stress, improving a person's mental state. A good mental state can help prevent physical disease. Physical activity also promotes health and well-being in other parts of the body, like the lungs and the heart. Inactivity and immobility can result in mental and physical problems, including loss of self-esteem, depression, pneumonia, urinary tract infection, constipation, blood clots, and dulling of the senses. Range of motion, or ROM exercises, can help prevent these conditions. With ROM exercises, the joints are extended and flexed in the measured degrees of a circle. Regardless of the physical condition, all clients typically should have some form of exercise included in their care plan. Exercise can range from simple ROMs to walking with assistance to specific exercise ordered by the physician and monitored by a physical therapist. There are several common disorders of the musculoskeletal system: fractures, osteoporosis, and arthritis. A fracture is a broken bone. To treat fractures, bones are held immobile, by a cast if possible, until the bone can fuse itself back together. This process can take longer in elderly clients than in younger people. Osteoporosis is a disease that causes bones to become porous or brittle. Brittle bones can fracture easily, so CCAs must be very careful when helping clients with osteoporosis. Arthritis is inflammation or swelling of a joint. It can result in pain and difficulty with movement. Swelling can also cause muscle damage, making it difficult or impossible for the client to move, or reducing muscle strength. You should observe and report any of the following: changes in ability to perform routine movements and activities, any changes in client's ability to perform ROM exercises, pain during movement, any new or increased swelling of joints, white, shiny, red, or hot areas over a joint, bruising, or aches and pains clients report to you. The nervous system. The nervous system is the control center and message center of the body. It controls and coordinates all body functions. The nervous system also senses and interprets information from the environment outside of the human body. The neuron or nerve cell is the basic unit of the nervous system. Neurons transmit messages or sensations from the receptors located in different parts of the body through the spinal cord to the brain. For example, if your hand touches a hot stove, receptors in your hand transmit that message that travels through the neurons and the spinal cord to the brain. The message is a sensation of heat. Your brain then reacts to the message, sending a message back to your hand to pull away from the stove. Nerves are easily injured and they heal slowly. Disorders of the nervous system can be extremely debilitating. The nervous system has two main parts: the central nervous system, or CNS, and the peripheral nervous system. The central nervous system consists of the brain and spinal cord. Both the brain and the spinal cord are covered by a protective membrane consisting of 3 layers. Between 2 of these layers is the cerebrospinal fluid. This fluid circulates around the brain and spinal cord, providing a protective cushion against injuries. The spinal cord is connected to the brain and is protected by the bones of the spinal column. Nerve pathways run through the spinal cord, conducting messages between the brain and the body. Common illnesses of the central nervous system are dementias, including Alzheimer's disease, Parkinson's disease, multiple sclerosis, epilepsy, and cerebral palsy. Dementia is a general term that refers to changes in the brain that alter personality and impair the ability to think and remember. Alzheimer's is an example of dementia with an unknown cause. It cannot be cured, is irreversible, and gets progressively worse. Parkinson's disease, another illness that commonly occurs in the elderly, causes a section of the brain to degenerate slowly and progressively. However, mental function is not impaired in the early stages. Symptoms of Parkinson's disease include tremors that may be most noticeable when the person tries to complete a task like picking up a glass full of water. A person with Parkinson's disease may also rub together the finger and thumb of one hand in a motion called pill rolling. Other signs and symptoms include a mask-like facial expression, slurred or monotone speech, drooling, muscle stiffness and weakness, slow movements, stooped posture and a shuffling gait or walk. As the disease progresses, the person may become confused and forgetful. Observe your clients carefully and report any of the following signs and symptoms: fatigue or pain with movement or exercise, shaking or trembling, inability to speak clearly, inability to move one side of the body, disturbance or change in vision or hearing, changes in eating patterns or fluid intake, difficulty swallowing, bowel and bladder changes, depression or mood changes, memory loss or confusion, violent behavior, any unusual or unexplained changes in behavior, decreased ability to perform their activities of daily living or ADLs. The nervous system, sense organs. The eyes, ears, tongue, nose, and skin are all the body's major sense organs. They are considered part of the central nervous system because they contain receptors that receive impulses from the environment and relay these impulses to the nerves. Changes in the sense organs occur as we age. Common disorders of the eyes and ears are cataracts, glaucoma, and vertigo. Cataracts, milky or cloudy spots that develop in the eye, are common in the elderly. Cataracts eventually impair vision and can affect one or both eyes. They can be surgically removed, and an artificial lens is usually implanted. After cataract surgery, clients must avoid bending over, sneezing, or falling for several days. Glaucoma is a condition in which the fluid inside the eyeball is unable to drain. Pressure inside the eye increases and causes damage that often leads to blindness. Glaucoma is usually treated with prescribed eye drops. Vertigo, or dizziness, is usually the result of an inner ear disturbance, but it can also be caused by diseases of the brain. In the elderly, the aging process commonly causes loss of hearing, as well as impaired vision, smell, and taste. Report any of the following observations about your clients to your supervisor immediately: changes in vision or hearing, signs of infection, dizziness, or client complaints of pain in their eyes or their ears. The circulatory or cardiovascular system. The circulatory system is made up of the heart, blood vessels, and blood. The circulatory system performs the following major functions: supplying food, oxygen, and hormones to cells, producing and supplying antibodies and other infection-fighting blood cells, removing waste products from the cells, controlling body temperature. Blood vessels in the skin constrict to keep the heat in the body and dilate to release heat and cool the body. A healthy cardiovascular system is essential for life. Cells, tissues, and organs need adequate circulation to function well. If circulation is reduced, cells do not receive adequate oxygen and nutrients. Waste products of cell metabolism are also not removed, and organs become diseased. The heart is the pump of the circulatory system. The interior of the heart is divided into 4 chambers. The two upper chambers, called atria, or left atrium and right atrium, receive blood. The two lower chambers, or ventricles, pump the blood. There are three types of blood vessels found in the body: arteries, capillaries, and veins. Arteries carry oxygen-rich blood from the heart out to the various parts of the body to very small blood vessels called capillaries. Veins carry the blood containing waste products from the capillaries back to the heart. Some common disorders of the cardiovascular system are atherosclerosis, also known as hardening of the arteries; myocardial infarction, often called an MI or heart attack; angina pectoris; cerebrovascular accident, also referred to as a CVA or stroke; hypertension, commonly known as high blood pressure; or congestive heart failure. Descriptions of each of these disorders are presented in the CCA text. Please take the time to become familiar with each of them. For the purpose of this video, however, it is most important that you learn how to recognize the common symptoms or signals of cardiovascular disorder. If your client exhibits any of the following symptoms, it should be reported to your supervisor immediately: weakness or fatigue, loss of ability to perform activities of daily living or the ADLs, swelling of hands, legs, and feet, pale or blue appearance of hands, feet, or lips, pain in the chest, left arm or neck or the jaw, complaints of a squeezing or heavy weight sensation in the chest, weight gain, shortness of breath, changes in breathing patterns, inability to catch their breath, severe headache, inactivity which can lead to circulatory problems. The respiratory system. The respiratory system of the body has two functions. Number one, it brings oxygen into the body. Number two, it eliminates carbon dioxide produced as the body uses oxygen. Respiration, the body taking in oxygen and removing carbon dioxide, involves breathing in, called inspiration, and breathing out, known as expiration. This process is accomplished by the lungs. Some common diseases of the respiratory system that you may encounter as a CCA include asthma, upper respiratory infection, bronchitis, pneumonia, emphysema, lung cancer, or tuberculosis. It is very important that people with acute or chronic upper respiratory conditions are not exposed to cigarette smoke or polluted air. When caring for a client with an upper respiratory condition, you may need to assist the client with deep breathing exercises or coughing routines. You will also observe respirations and remind the client to take medications. People who have difficulty breathing will usually be more comfortable sitting up than lying down. Clients with severe breathing difficulties may be placed on oxygen to give relief and assist in breathing higher oxygen levels. CCAs should immediately report the following respiratory ailment symptoms: a change in respiratory rate, shallow breathing or breathing through pursed lips, coughing or wheezing, nasal congestion or discharge, sore throat, difficulty swallowing or swollen tonsils, the need to sit after mild exertion, the need to rest on two pillows, pale or bluish color of the lips and extremities, pain in the chest area, or discolored sputum, green, yellow, blood-tinged, or gray. Because the respiratory and circulatory systems work together to supply oxygen to the body, failure of one system often means there will be damage to the other. The urinary system. The urinary system has two vital functions. Number one, through urine, it eliminates waste products created by the cells, much as the lungs remove carbon dioxide from the blood. And number two, it maintains the water balance in the body. The kidneys are located in the upper part of the abdominal cavity on each side of the spine. These two bean-shaped organs are protected by the muscles of the back and the lower part of the rib cage. When blood flows through the kidneys, waste products from the cells and excess water are filtered out. Necessary water and substances are reabsorbed into the bloodstream, while waste and the remaining fluid form urine. The body must maintain a proper fluid balance between water absorbed in the body and waste fluids that are released from the body. Common disorders of the urinary tract include urinary tract infection, kidney stones, nephritis, renovascular hypertension, and chronic kidney failure. Please refer to the CCA text for explanations of each of these conditions. Watch for the following signs of urinary tract disorder: weight loss or gain, swelling in the upper or lower extremities, painful urination or burning during urination, changes in the characteristics of urine such as cloudiness, odor, or color, changes in frequency and amount of urination, swelling in the abdominal bladder area, client complaining that bladder feels full or painful, incontinence or dribbling, pain in the kidney or back in the flank region, inadequate fluid intake. Be sure to report to your supervisor immediately if you notice any of these symptoms. The gastrointestinal or GI system. The gastrointestinal system has two functions: digestion and elimination. Digestion is the process of preparing food physically and chemically so that it can be absorbed into the cells. Elimination is the process of expelling solid wastes made up of the waste products of food that are not absorbed into the cells. The GI system, or digestive system, is made up of the alimentary canal and the accessory digestive organs. Food passes from the mouth through the pharynx, esophagus, stomach, and small intestine, where nutrients are absorbed from the food into the bloodstream, then into the large intestine and out of the body as solid waste. The teeth, tongue, salivary glands, liver, gallbladder, and pancreas are all of the accessory organs to the process of digestion. They help prepare the food so it can be absorbed. The stomach, a muscular pouch located in the upper left part of the abdominal cavity, provides physical digestion by stirring and churning the food to break it down into smaller particles. The glands in the stomach lining also aid in digestion by secreting gastric juices that chemically break down food. Some common disorders of the gastrointestinal tract that you may encounter in your clients include heartburn, gastric reflux, nausea and vomiting, peptic ulcers, constipation, diarrhea, hepatitis, colitis. Again, look for descriptions of these disorders in the CCA text so that you can develop a good understanding of what your clients are going through. Observe and listen to your clients for indications that they are experiencing changes in the gastrointestinal system, including difficulty swallowing or chewing, including denture problems or mouth sores, fecal incontinence, losing control of your bowels, weight gain or weight loss, anorexia or loss of appetite, abdominal pain and cramping, diarrhea, nausea and vomiting, especially vomitus that looks like coffee grounds, constipation, flatulence or gas, hiccups or belching, abnormal colored stool, especially bloody, black, or hard, heartburn, poor nutritional intake. Any of these signs should be reported to your supervisor, especially if they persist. The endocrine system. The endocrine system is made up of glands that secrete hormones. Hormones are chemical substances that control many of the organs and body systems. They are carried in the blood to the various organs where they perform many functions, including the maintenance of homeostasis, influencing growth and development, regulating levels of sugar in the blood, regulating levels of calcium in the bones, determining how fast cells burn food for energy. The function of the endocrine system is to secrete hormones that regulate essential body processes. There are several different glands in the endocrine system. They are the pituitary gland, the thyroid gland, the parathyroid glands, the pancreas, 2 adrenal glands, gonads. Thyroid disorders and diabetes are common problems of the endocrine system that may affect your clients. Symptoms of diabetes include increased thirst and urine production, hunger, and weight loss. If you notice these symptoms in the client, it is important that you report it immediately. The client may not know that he or she has a problem. Some clients who already know they have diabetes may perform frequent urine and/or blood tests to determine the level of sugar in the body. Their care plan for the client with diabetes depends on the severity of the disease. Mild forms can usually be managed by diet alone or by diet and oral medications. In other cases, clients may require insulin injections in addition to diet restrictions. CCAs are never allowed to perform such injections for clients. If a client is unable to self-administer his or her injection, notify your supervisor. Meals for clients with diabetes must be served on time, and clients must eat all foods served. Good skin care is important, especially for the feet. Clients with diabetes are susceptible to skin infections that heal slowly. Foot and leg wounds can be very serious. If not controlled, diabetes can affect other organ systems. Uncontrolled diabetes can lead to any of the following health problems: blindness, diseases of the kidney, diseases of the nerves, diseases of the circulatory system, including stroke, heart attack, and slow healing, frequent infections, gangrene, which can lead to amputation of an affected body part. Many endocrine illnesses can be treated with hormone supplements. These supplements must be given very precisely. For example, clients with diabetes can go into insulin shock if they get too much insulin. A diabetic coma can occur if a diabetic client does not receive enough insulin. Both insulin shock and diabetic coma can cause death. You should observe clients with endocrine disorders carefully. Report any of the following signs and symptoms to your supervisor: headache, weakness, blurred vision, dizziness, hunger, irritability, sweating, change in normal behavior, weight loss or gain, loss of appetite or increased appetite, increased thirst, frequent urination, dry skin, excessive perspiration, sluggishness or fatigue, or hyperactivity. The reproductive system. Very simply, the reproductive system is made up of the reproductive organs. The function of this system is to allow human beings to create new human life. The ability to reproduce begins with specialized cells that are formed in the male and female reproductive glands called the gonads. In the male, the gonads produce testosterone. In the female, the gonads secrete the hormones estrogen and progesterone. The CCA text has an excellent explanation of the reproductive process, so we won't go into that here. Suffice it to say that there are many disorders that can affect this system, and they are no less important to watch for and report. Diseases of the reproductive system include cancers of the breast, prostate, and ovaries, just to name a few. Be sure to report any of the following signs to your supervisor: discomfort or difficulty with urination, discharge from the penis or vagina, swelling of the genitals, changes in menstruation, blood in the urine or stool, or breast changes, including size, shape, lumps, or discharge. The immune system. The function of the immune system is to protect the body from disease-causing bacteria, viruses, and organisms. The immune system protects the body in two ways. First, through nonspecific immunity, which protects the body from disease in general. And the second is through specific immunity, which protects against a particular disease that is invading the body at a given time. To protect itself against disease, in general, the body has several mechanisms. First, anatomic barriers, which include the skin and the mucous membranes, provide a physical barrier to keep foreign materials like bacteria, viruses, or organisms from invading the body. Physiologic barriers, including body temperature and acidity of certain organs. Most organisms that cause disease cannot survive high temperatures or high acidity. The body can raise its temperature by running a fever to kill off the invaders. Inflammatory response refers to the body's ability to react to infection by inflammation or swelling of an infected area. When inflammation occurs, it means that the body has sent extra disease-fighting cells and extra blood to the area to combat the infection. Some additional information about specific and acquired immunity is available in the CCA text. Be sure to take a look at it. Symptoms of immune system weakness or failure include recurring infections, such as pneumonia, diarrhea, and fevers, swelling of the lymph nodes, increased fatigue. Report any of these signs to your supervisor. Some clients may have weakened immune systems due to certain cancer treatments or other diseases. These clients must not be exposed to bacteria or viruses that their bodies are not prepared to fight. Particular care should be taken to be sure that the home environment is clean and that the chance of infection is minimized. The lymphatic system. The function of the lymphatic system is to remove excess fluids and waste products from the body's tissues and to help the immune system fight infection. It's closely related to both the immune system and the circulatory system and consists of lymph vessels and lymph capillaries in which a lymph fluid circulates. Lymph is a clear yellowish fluid that carries disease-fighting cells called lymphocytes. When the body is fighting an infection, swelling may occur in the lymph nodes, oval-shaped bodies that can be as small as a pinhead or as large as an almond. Located in the neck, groin, and armpits, the lymph nodes filter out germs and waste products carried from the tissues by the lymph fluid. After lymph fluid has been purified in the lymph nodes, it flows into the bloodstream. Lymph fluid is circulated by muscle activity, massage, and breathing. A sore muscle may feel better if you rub it because the rubbing action helps the lymph fluid circulate, carrying waste products away from the tired muscle. In summary, the human body is a complicated piece of machinery. Even for physicians and nurses with years of education and experience, remembering every sign and symptom of every disease is very difficult. Just the few signs and symptoms mentioned in this section may seem overwhelming. This is why it is so important to take note and report any change in your client. From the color of a patch of skin, to changes in the client's abilities, to differences in the client's attitude. Your observations could reveal important signs of a significant problem. CCAs, because they see clients much more often than other healthcare providers, are in the best position to observe and report changes in a client's health and well-being. Make noticing these changes a mission for you. I thank you for the time that you've put in on this section. Take the time to really master it and then join Steve Everhart in the next section as we explore changes that occur with aging. Until we see each other, have a great day.